Wow, it's pretty easy for you because you have a pretty different story, but I don't. I was born in a middle-class American family with both of my parents still alive. Hi, welcome back to my channel. My name is Dr. Christina Nguyen and I am a family medicine physician. I'm also an entrepreneur and a mother. In this channel, I want to share with you my insights and experiences to help you be more successful and fulfilled in life. In this video, I will show you my 4 biggest tips to ace medical school interview. In order to become a family medicine doctor, I had to go through a lot of interviews to get into college, a lot of interviews to get into medical school, a lot of interviews to get into residency, and then a lot of interviews to get the job that I want. So, I have a lot of experience with interview. And by the end of this video, you will know exactly what to do and how to answer to ace your interview. If you have an interview coming up or if you want to prepare for your future interviews, then keep on watching. My first tip is to prepare your mindset. Now, repeat after me. Interviews are not scary. And let me explain. In order for you to get the interview, you must already be the best of the applicants. The committee has already read your application. They saw your GPA, your MCAT score, your list of activities and achievements, and they have read your personal statement. The reason that you're sitting in the interview is because the committee has already liked you and now they want to meet you in person. They want to get to know you and have a sense of your personality. So take a deep breath. The best thing you can do is to be yourself. One of the most common mistakes students make is that they try to impress the interviewer so much that they indirectly and accidentally recite the resume and personal statements. Doing this not only bores your interviewers to death, but you've also blown your only chance to make a personal connection with them. Remember, interviews are a two-way street. Imagine you are on the first date with someone you met on the internet. You have read each other's profile, you've seen all the photos, and now the purpose of the date is for you to see each other in person and decide if there's a good fit. Same thing with medical school interview. The interview is as much for you as it is for the medical school committee. The purpose is the same. It is to decide whether this medical school will be a good fit for you. And when you think about it this way, you will feel so much more confident and in control of the interview. Instead of feeling that you are being grilled, you shift the focus toward you asking the question and finding out for yourself if this will be a good fit. For example, as an Asian American, I am interested in the diversity of the school, so naturally I would ask questions about that. If you're interested in doing research, you would want to ask questions about research opportunities. If you're particularly interested in mission work, then you will be naturally inclined to ask questions about that. The options are endless. The key here is to figure out what you're interested in, what you want to know about the school, and ask questions about that. And in fact, when you approach it this way, the committee will see that you are truly interested in their program and that you truly want to be there. Tip number 2, know your story. Here comes the most dreaded question. Tell me about yourself. The bad thing about this question is that it is so vague, but the good thing about this question is also that it is so vague. The fact that it's so open-ended, you have the ability to steer the conversation toward a direction that is most natural and comfortable for you. For example, when I was going to medical school interviews, I was asked this question at almost every single school. And my answer was, I am a Vietnamese American. I immigrated to the US when I was 14 years old with my mother and a younger sister, 2 years after my father passed away in an accident in Vietnam. This came very natural to me because it is the core of my identity. This is important to me and who I am. And you may say, Wow, it's pretty easy for you because you have a pretty different story, but I don't. I was born in a middle-class American family with both of my parents still alive. I haven't had much hardship in my life, and I haven't done anything that is out of the ordinary. How can I stand out? Here is the thing. In this universe, there is only one of you. And all you have to do is know your story and how you want to communicate that story so that the person sitting across from you can see life through your perspective. Tip number 3, how to answer difficult and controversial questions. Take this question. A patient with Down syndrome became pregnant. The patient does not want an abortion. Her mother and husband want the patient to have an abortion. What should a physician do in this situation? Question number 2. A member of your family decides to depend solely on alternative medicine for treatment of his or her significant illness. What would you do? What do these questions have in common? And what would you answer if you were asked one of these questions during your interviews? The reason that these questions are so difficult to answer is because students always want to try and find the right answer. However, a lot of time, these questions do not provide enough information for you to come up with the right answer. Take the first question. A patient with Down syndrome became pregnant. The patient does not want an abortion. Her mother and husband want the patient to have an abortion. What should a physician do in this situation? Now, your gut instinct is to decide, should I let the mother and husband proceed with the abortion or should I not? And that is not the point of the question. What you want to do as a physician in this situation is to actually have a conversation with every party, including the patient, the mother, and the husband, to hear their perspectives of why they want to proceed in a certain direction. Your job is to empathize with them, not necessarily to agree with any of them. Additionally, you should recognize that you do not have enough information. You would want to say, I would want to get additional information. For example, I want to know how far along is the pregnancy? What is the legal status of abortion in your patient's states? Does the patient have the capacity to make her own decision, or does the patient have a legal guardian? You also want to know what is the policy of your healthcare organization. You also want to seek guidance from your healthcare organization ethics committee for these situations. You may think that questions like these are meant to give students a hard time. However, in reality, these are the situations that doctors has to face almost daily. And in this situation, it's not the knowledge, it's not the clinical skill, but it is the ability to empathize that makes the biggest difference in patients' experience. And if you're interested in learning why empathy is one of the most important skills that a physician needs to have and how to be more empathetic, say yes in the comment below. The other important point that this question demonstrates is the ability for doctors to recognize the importance of teamwork, of knowing when to ask for help from other members of the healthcare team. Doctors never work alone. I never work alone. Every day I rely on my team of medical assistants, nurses, pharmacists, dietitian, physical therapy, and social worker to help deliver the best care for my patient. It is important to realize the limitation of your position and to utilize the skill sets of everyone in your team in order to get the best results. What other question do you find challenging in your medical school interview? Make sure to share with me in the comment below. And last but not least are the basic interview etiquette. This starts the moment you receive the invitation for interview, and it doesn't end until you receive a decision letter from that school. Your goal is to always put your best foot forward, always be professional, and project confidence. This means replying to the invitation timely and with respect. This means showing up at least 15 minutes early to be ready. This means dressing formally and conservatively. This means to always greet everyone with a smile and a firm handshake. This means to follow up with a thank you card to show your appreciation. These basic etiquette, no matter how small or insignificant they may seem, they will help you make a good impression with the medical school committee. And in some cases, they can mean the difference between an acceptance versus rejection. So far in this video, you have learned my 4 biggest tips to help you ace your medical school interview. And that includes, number 1, have a good mindset. Number 2, know your story. Number 3, prepare to answer controversial questions. And number 4, having basic etiquettes. I hope that these 4 tips will help you be more prepared and come into interview with confidence and ready to shine. If you like this video and think that it was helpful for you, click subscribe and hit the notification bell for my future videos where I will continue to share with you my honest tips and tricks, insights and experience to help you be more successful and fulfilled in life. Thank you for watching and I will see you next time.